This video will review the purpose of and how to complete the pre-placement report. The student will complete items 1 and 2 of the report and will send the partially completed report to the placement preceptor at least 1 week prior to the placement for the preceptor to review. In this way, the preceptor can consider the strengths and learning objectives of the student when planning placement activities. Learning objectives, item number 2, should be grounded in ICDEP competencies and performance indicators based on the student's past performance evaluation findings and in consideration of the placement's unique learning opportunities. Students should clearly identify what actions, opportunities, and activities will enable their learning and highlight the behaviors that will demonstrate they have accomplished the learning objective. For example, if this is a placement with opportunities for counseling, the student should focus their learning on maximizing their placement time using this skill. The learning activities involved in counseling correspond with several ICDEP competencies and performance indicators that the students will identify in the first column. For example, 3.03F, provide nutrition education and counseling. To continue with this example, the student may take the following actions to develop their counseling skills. They may review information provided during the motivational interviewing education session prior to beginning the placement. During the first few days, they may indicate that they would like to observe their preceptor counsel patients. They may wish to review the common patient education tools and resources used in the clinic. The student may set goals such as, by the end of the first week and with the preceptor and patient's consent, I will practice gathering patient assessment data. Or they may say, by the end of the placement, I will demonstrate the ability to accurately gather patient assessment data and propose nutrition care goals based on the data and patient wishes. I will provide nutrition education using available education tools and support the nutrition care plan. The preceptor should set aside some time during the first week to discuss the student's learning objectives and feedback approach for the placement, items 2 and 3 on the report. Students may need to revise their learning objectives based on the available learning opportunities in the placement setting. The discussion points on the second page of the pre-placement report are an opportunity for the student to highlight their preferred learning style and feedback approach. These discussion points are intended to support the conversation between the student and preceptor when finalizing item number 3, outlining the feedback process for the placement. By the end of the first week of placement, the student and preceptor will finalize the pre-placement report. Once completed, the pre-placement report should be signed by the student and preceptor. By checking the response box at the end of the form, you are verifying the information is true and correct. The checked response box is accepted as a replacement of a handwritten signature. The signed and completed form is emailed to the dietetic education coordinator by the end of the first week of placement. This can be done by either the student or preceptor. Please ensure to include everyone on the email, that is the student, the preceptor or preceptors, and the dietetic education coordinator, so that everyone has a copy. The student will upload the completed checklist to their OWL Dropbox.